Meanwhile, the World Health Organization has expressed worry over the mass exodus of Ghanaian health professionals out of the country in search of greener pastures. Recent surveys have shown that at least 3,000 registered nurses and midwives left Ghana for better working conditions in Europe and the USA, with a breakdown of the details showing that over 90% of Ghanaian doctors prefer to work outside the country. Speaking on foreign affairs on JoyNews, representative of the WHO to Ghana, Professor Francis Kasolo, noted although better working conditions might be the root cause of the health worker migrating, immediate steps must be taken to safeguard the potential impact on Ghana's fragile health system.
It is worrying that in Africa, specifically in Africa, where the numbers per capita of health workers is low, that we're losing not just health workers, but we're losing the experienced health workers for quote-unquote greener pastures. This is an experience that has had what I would call kind of a cyclical movement. As it goes up in countries, comes down, and so on. And it's related to many, many factors, not just monetary. It is related to the quality of the facilities that our health workers are working in. It is related to where you are posted to work. If you are a young gentleman recently married with a 3, 4, 5-year-old child who needs to go into primary school, into nursery, and then you are posted for a long period of time in an area where there is no nursery facilities, you start feeling that, oh, you're being punished. I mean, I've gone through it. You feel like you're being punished. And that's why WHO, for instance, through different World Health Assembly discussions, has come up with guidance on how to sensibly manage health worker migration, especially to what I would call the developed world, because that's where most people are going, or to countries that are able to pay better salaries, right, but also offer better working conditions in terms of where you are working and so on. And this guidance specifically encourages two things. One, discussions between recipient countries and countries that are losing the health workers. And this discussion is really about how can we contribute to retaining health workers within the country. Or if they go, how can we get external capacity to come and build the same capacity that has left? So that discussion has to take place. The bilateral discussion between countries on this have to take place, under the guidance, of course, of the different guidance that WHO has given. Internally in a country, how can we work with partners, with government, with civil society to improve the conditions, including the communities, to improve the conditions of our health workers? I visited recently Volta region and Oti. And in one of the towns or chiefdoms I was invited to, the community has had taken the responsibility of starting to build health worker houses. Okay. They raised the money, they have a health facility. They looked at it and said, look, if we do not have accommodation for our nurses, for our physician assistant, these young people are going to leave. So they've gone around, they were almost completing the facility. And this is what we are saying, that the retaining health workers in your community is not just a government responsibility, it's also a community responsibility. I would want to have as near to me as possible a health facility, so that when I have malaria, I know I can be taken there and there's a health worker to treat me. So it's a combined effort of trying to retain the health workers, but at the same time also giving incentives.
Meanwhile, former Vice Chancellor of the University of Health and Allied Sciences, Professor Fred Binka, says more health trainers must be recruited in order to shore up the numbers leaving the country. He was speaking on sidelines of a separate event here in Accra.
Look, this thing has been with us for more than 2 decades. It's not today it started. We are just playing the ostrich. We know that this is a problem, but it's a welcome problem. It's a very welcome problem for us. First of all, our nurses and the health workers we are training, the ministry is not able to absorb them. You are aware of that. For the first time in the history of this country, doctors who finish house jobs sit home for 2 years. It doesn't just make sense. Number two, why are there people moving on the brain drain? The brain drain is happening because through the COVID, most health workers in the developed world don't want to work in the health sector anymore. Too many people died. They're depressed. Okay? But we have the other problem. We have too many people wanting to be trained as health workers. We can fill the Accra Sports Stadium tomorrow just by one announcement. Okay? All we need to do is that there are certain requirements that we're not making people to get into the training schools. One, government's official cutoff point is 25, but nobody has ever entered training school at 25. By 20, you can't find a place. Two, we don't have too many lecturers. So I have been proposing long ago that go to the US, go to United Kingdom, go to Canada, sit down and say, hey, each of these countries, we need 50 of your best lecturers. You will pay for them. They will come here. They will help us to train our people who want to be trained. Some will go, some will stay at your cost. I mean, is it not ridiculous for us to be suggesting that the minister said for each nurse or somebody who leaves, they will want to take £1,000? Goodness, how did they arrive at £1,000? Is that the cost of the training? But that £1,000, where does it go? Does it go to the institution that trained them so that they can train more? You know, so we're not just being serious about this.